Welcome back to Veterans Forum, a program by veterans, about veterans, for veterans and their families. I'm your co-host, Bob West, with Ray Chattery. Jerry Devlin's on assignment. We're here to provide you and your family with important information on legislation, benefits, support, and activities important to you and your family by interviewing leaders in our community. And who do we have with us today?
Bob, today we're very pleased to have Dana Hendrickson. She's the Director for Outreach and Advocacy Program for the Maryland Department of Veterans Affairs in Annapolis, and of good note, she was born in Annapolis. Dana received her bachelor's degree in criminal justice from University of Delaware in 1997, her master's degree in psychology from Towson University 2005, and she completed Towson University Center for Professional Studies Certified Associate in Project Management in 2014 with a focus on leadership and goal attainment. And what we'll do is, that's pretty much the basic part, and we'll have Dana fill in the blanks as we go along. So, Bob, let's
Okay, we're ready to roll, I think.
ready to
right?
roll.
Well, welcome, Dana.
Thank you.
I was very interested in your title as Director of Outreach and Advocacy Programs, because outreach is pretty important to us as veteran service organizations to contact all the veterans we can in Bowie any way we can. So we're looking for some hints and tips on how we might be able to do our job a little bit better too. So with that, why don't you tell us a little bit about the programs that you have as far as outreach and advocacy is.
Sure. Well, first off, thank you very much for the opportunity to be here with you. I firmly believe that the real change and means of getting information out to our veteran community does happen at the local level. So I'm really excited to be here with you this evening. And on behalf of our secretary, I do bring greetings. So for the last 4 years, I have served as Director of Outreach and Advocacy for the Maryland Department of Veterans Affairs. We are as I say, a relatively small state government agency. We operate 5 core programs, and it is my job and that of my Deputy Director, Denise Snowy, to ensure that we're informing the almost 400,000 veterans who call Maryland home, informing them on our programs. So it is important that we are informing them on our service and benefits program to ensure that our veteran community is accessing their VA benefits, whether it's health care or compensation for disability or pension. We provide education and outreach on Charlotte Hall Veterans Home, which is our assisted living and skilled nursing home in St. Mary's County. We also provide education and information on our state veteran cemetery program and our veteran memorials that are scattered about the state. And also we provide education on our Maryland Veterans Trust Fund, which is a trust that's been set up to assist veterans who are experiencing temporary financial difficulties. So we perform this outreach and this advocacy through my program. Like I said, I've directed that for the past 4 years, and it's been quite an honor to see the program flourish and grow. And to see our name really getting out there, especially out into our rural communities. We have to ensure that we are providing outreach on a number of different levels because our veterans are accessing information in a variety of different ways. So we utilize website, we utilize social media, printed publications, we are providing briefings all across the state, whether it's to groups of veterans themselves, family members, or providers that are serving veterans. We also have an email distribution. We distribute in a bi-weekly electronic newsletter that is now going into 80,000 plus email inboxes on a bi-weekly basis, which is really exciting for us.
And I'm one of those.
Me too.
Yeah.
It has really, truly grown. So we have to be really creative in how we're getting information out, and as I mentioned, most importantly, getting out into our local communities and providing information on what we're doing for our veterans here in Maryland.
So do you have a regular routine where you go out to various counties throughout the year, and are you programmed to do this on a regular basis? And when you do that, where do you typically go?
We are just about everywhere. It is not often that we have to plan our own events. We may on occasion reach out to a particular organization and share information about our department and encourage them to invite us to facilitate a briefing for their organization, their veteran membership, or their provider membership who might be serving that particular organization. But to be perfectly honest, the approximate 300 meetings and events that Denise and I attended last year, they were overwhelmingly at the invitation of the particular organization. We go out to traditional veteran service organizations, we staff resource tables and provide briefings, but interestingly enough, we are actually starting to provide briefings to employee resource groups. It wasn't too long ago that I provided a briefing to Verizon, to their Veterans Affinity Group. We are growing in our abilities to be creative. We are briefing the Department of Disabilities, the local departments of aging. We've briefed the library system across the state. So we're really looking at ways that we can be as creative as possible and kind of branch out beyond kind of that traditional resource fair where we might be inviting veterans to attend, because it's just as important to get information into the hands of the providers that are serving veterans as well as getting that information into the hand of the veteran.
That's a pretty broad brush that you're, because I thought you would limit yourself maybe to like county government organizations or things like that, but actually outreaching to corporations, especially the major corporations that do have veterans employees, and maybe schools, like Bowie State has an ROTC unit, it has a Veterans Club. We've contacted them on a few occasions, we've had them here as our guests, and but still trying to continue the outreach and then get people involved in letting us know what services they might need, because there's a lot of them out there as far as services are concerned, and we run into people that say, gee, I didn't know that. Well, you know, you need to stop by and talk to somebody someplace.
Yeah, one thing that I was really congratulate you on is when they had the landing zone up in Timonium, you and Denise and the secretary were there, and I mean, it was a tremendously well planned and successful event. I got there on Sunday and spent several hours there, and as I say, and it was like 50 other vendors there, you know, getting the word out. But as I say, you're there all the time, and it's really, really neat that that you do this.
Thank you. It's an honor.
So with the electronic newsletter that I see every couple of weeks, you have Facebook and you do Twitter and so forth. So how successful are those? Because, you know, for us guys with gray hair, you know, some of the stuff is sort of like, wow, how do they do this kind of thing?
Well, I have to say, in your defense, when you mentioned gray hair, my 96-year-old grandmother is on Facebook. So
well, that's good.
I'm a firm believer that Facebook has no age limit to it. So yes, we do have a social media presence on both Facebook and Twitter. And our annual report that I just published indicated that we had about 80,000 hits on Facebook posts last year. So we have to, and I say we, I guess I should say I, since I manage our social media, but I try to be very creative in the posts that I am providing onto Facebook and Twitter, and making sure that I'm tagging a lot of different organizations, our traditional veteran service organizations, our state agency partners, our local county governments, to ensure that the posts that I do place onto Facebook and Twitter have a very broad reach.
Now, at least the information we have, Prince George's County has the largest veterans, number of veterans of any county in the state. And Ray and I have been involved in the county programs from the very beginning. And we know that, for example, they have a veteran contact at the Department of Housing, you know, resources and so forth. And it's, you know, so the whole idea is there's things out there that you're also tied in with those folks, providing them with some additional information too.
Definitely. Prince George's County is blessed in the sense that we have two veterans benefit specialists located in Camp Springs, close to Joint Base Andrews. We collaborate heavily with the Prince George's County Office of Housing and Social Services. I represent the department on the state's Interagency Council on Homelessness, so we've done a good job of getting information down to the local levels on how offices of social services and homeless services offices can connect to VA resources. Maryland's commitment to veterans, which is a behavioral health initiative. Of course, it's a statewide initiative, but Rick Reed is the resource coordinator for Prince George's County. So Prince George's County, when it comes to the provision of veteran services, there's a homeless services presence, behavioral health, employment, benefits. So Prince George's County, and by way of their commission, is pretty active in the community insofar as trying to get information down to the home, to where the veteran is residing.
And I don't want to put you on the spot, and this is for the audience. This is not rehearsed. This is off the cuff. Are you familiar with the Summerfield Project?
I am not.
Okay, when we had someone here not too long ago, they weren't either. Now, since you're with Joint Base Andrews, and this is where the Summerfield Project is, when we were on the commission, we found out that it's only 4% occupied. And the government pays about $17 million a year to keep it up. You may want to check into this, to put homeless veterans, families and such. And this over here in Prince George's County, near where Joint Base Andrews is. So like I said, I don't know if it's one of those best kept secrets or not, Bob, because we really delved into this when we were on the commission, and we didn't. Well, once we left, we didn't know whether it fell by the wayside or not. But something to check in. Secretary Owens may know about it, but it'd be something to check into.
Definitely.
Because this would be something really, really big to put a large population, if it's possible. Like I said, I don't know the nuts and bolts. I just know the name of the project. Yeah.
One of the biggest issues that we have is trying to reach out to women veterans and trying to get them involved. Some of them, to our surprise, didn't even think they were veterans. And we welcome them into our service organizations. What we don't do is ask them, what branch of service was your spouse in? That is not the question we ask. When they come in the door, it's basically, how can we help you, so forth. So how are you finding, reaching out to women veterans?
Well, interesting to note, to your point, is women veterans are the largest, fastest growing population of veterans nationally. So it's definitely a topic that needs to be considered, and we need to be mindful of that. And to your point, I did not serve, but I have heard from women veterans who say, well, I didn't serve in a combat role, or as a female, I just don't consider myself as a veteran. And it's really just communicating the message, encouraging them, begging the question to not ask, oh, what branch of service was your spouse in? What branch of service, in which did you serve?
Did you serve? Correct.
Or have you ever served in the military? It's what we're trying to do across the state is to encourage organizations that are working specifically with veterans or that are touching veterans, is to ask the question, have you ever served in the military? To not ask the question, are you a veteran? Because what organizations are finding, it is evidence-based. An individual is much more inclined to say yes to, have you ever served in the military, in contrast to, are you a veteran? We work closely with Women Veterans Interactive and a couple other local organizations. We actually had a resource table at a Women Veterans Stand Down that was just facilitated at the Community College of Baltimore County in Catonsville last fall with the Baltimore County Women's Veterans Foundation. We just try to ensure that we're being very diverse in our outreach. So we're very mindful of when we receive those invitations to staff resource tables or to provide briefings to women veteran-centric events. We try to give them a priority to ensure that we can get there.
Well, technically speaking, women were not really in a combat role until 1990, with first Gulf War. Because the people that served in Vietnam, were administrative. They got the ribbons. And what they're still fighting is the nurses and the chaplains and corpsmen that were non-combatants to get them the Purple Heart. You know, and as I say, there again, of course, there's no question now, and I think because of the way the military has changed since 1990 is why more women are going in there, which is really great. And one thing Bob and I can say for here in Bowie is that we've had women come through the door and we welcome them and everything. And after a couple meetings, they'll say to us, "Do you know this is the first place that I have ever felt welcome?" Isn't that right, Bob?
Right.
I mean, because we welcome. In fact, twice now. The first time a lady came in, I need a chaplain. Would you please be my chaplain? Or I need this. Would you take this position over? It's like, oh my gosh, I haven't got my feet in the door yet, you know. But it made them feel welcome and made them feel needed and supported. So, like I said, we have, being at the DAV here, as I say, we live veterans organization. We live on a 24/7.
Right. And one thing to that point of wanting to ensure a welcoming atmosphere, for example, the Dundalk Vet Center. The vet centers are nationwide. They provide readjustment counseling services to combat veterans. But the Dundalk Vet Center actually has a little child care corner because they recognized that child care is an issue.
Yeah.
You know, a veteran who is in need of readjustment counseling, they may not otherwise have a babysitter
Right.
or a child care provider. So they thought about it and they got creative, and they have a children's corner. It is closed-circuited, you know, it's televised into the therapist's office so that the veteran can engage in counseling and rest assured that, I mean, they can see their child right there up on the screen. So it's thinking about ways to make our providers or our veteran service organizations more welcoming for women who might be coming in with children, who want to meet with a service officer, but have a 3-year-old in tow. It's having a bookshelf with some children's books or some toys. So that way they know, oh, well, gosh, you know, I really need to talk with a service officer, but I don't have a babysitter. Well, if they know that there's a little corner that their children can play in while they're meeting with a service officer, it's going to make them feel more comfortable and more welcomed.
The Annapolis Vet Center, have you been there?
I have.
Are they equipped like that yet?
You know, I have not been there recently. I don't know if they have a child's play area or not.
So I didn't know about this. Our service officers, we have 3, they go there once a month to service veterans in the Annapolis area that can't get to Bowie. And our service officers meet at the DAV every month. In fact, they're there now. Every Monday evening between 7 and 9. They're there to meet with veterans, and we have them in the hall where they can be privately. They're not in the bar area like they used to be. And as I say, we have 3 fantastic service officers. So there again, if you ever need of something, just give me a call, and we'll put you in touch with them.
Definitely.
Yep.
We had a representative from McVet here. And as far as women's issues are concerned, and they're obviously having more women go through their program, and they had to do some changes, obviously, to make them feel comfortable. And their issue was what you were bringing up about children, and they said, you know, a lot of women veterans have children, and you know, they said right now we're not equipped to handle that, and they're taking steps to address that. But it was sort of like another thing that kind of opened up about, wow, this is really different from having, you know, the regular men who were coming out with issues. So there's all kinds of interaction that has to be done and programmed into the system, and everybody's understanding this. It's just taking a while to get this thing going, and the more women that are active, they can get these things moved through, like Dr. Joanne Fisher,
Right.
with her women's
women
organization.
veterans, right.
I don't know if you know Joanne. Yeah, well, yeah, if you've met her, you know Joanne. So I mean, yeah, she's that kind of a person, you know. She lights up the room. I was also interested in what you had said earlier, is the number of contacts that you get each month that have to do with Maryland veterans who are being discharged, and you send them out some packages. I mean, it'd be great to be able to get that list, but anyhow, could you tell us more about that program and how that works?
Sure. So for a veteran who is, or an individual who is retiring from the military or separating and who is returning to Maryland, we receive a copy of their discharge paperwork, their DD-214. Contained on that document, obviously, is their name, their address. We take that information and we are able to send to returning veterans a packet of information to their home address or their home of record. We put into that packet our state Veterans Resource Guide. We put information in there on Maryland's commitment to veterans, on the Veterans Employment Program with labor, the locations of all of the federal VA medical centers and community-based outpatient clinics, and some other information as well. We send about on average, probably about 2,500 of those a year.
Okay, and you're not getting that information from the VA. I assume, are you? Or are you
No.
getting it from the Department of Defense?
We're receiving it from the DD-214. So
Okay.
the Department of Defense, those DD-214s are sent to us
Okay.
electronically.
So each service sends them to you as the individuals are being discharged.
It's actually all electronic now. It's actually an online spreadsheet
Oh, yeah?
that our staff download into Excel.
Well, that's interesting. And so it's from that information that they respond back to you as far as what their needs are or to gather more information.
We send it's a cover sheet. It's a letter from the secretary, and contained on that that welcome home letter, it has our direct contact information, and then of course within the resource guide, it has all of the contact information for all of our programs and our directors.
Now, do you only do it once to these veterans, or do you do it more than once, or how does that work?
It's a one-time mailing that we do to all returning veterans.
Okay, and but there's no follow-up after that. They get a one-shot, and like there's no other, like a little mailer going out or anything like that?
We do not. We encourage them to connect with us by way of our electronic newsletter. It's a really quick, almost in real time way for us to be able to communicate current information to them.
Okay.
There's one question I have, Bob, before we run out of time. Charlotte Hall was like 92% occupied, and I was very instrumental in helping get Phase 4 finished way back when. I served on the commission for 9 years, and now I think up in Rosewood they're looking for another Charlotte Hall or a veterans home. How far along is that? Do you know?
I can say that at this point they're still in communications with the state as well as the county to determine if that location is going to work for a second veterans home. It is still very much at the forefront of the conversation within our department.
Right,
we
okay.
really, truly want to see a second veterans home come to Maryland.
Yeah, one thing is really neat is we have McVet, which is the homeless shelter, or they got it takes care of the veterans, which is premier, and Charlotte Hall is premier, and we have 5 cemeteries. So Maryland, I'll tell you, is in the forefront of serving veterans, really in the forefront, and our department should be very, very proud of that.
It's truly an honor
Yes.
to be able to serve.
You certainly have a lot of outreach activities. So where does the advocacy come in?
We receive emails and phone calls from veterans who are experiencing challenges getting connected to the VA healthcare system, for example, or to another state agency, maybe getting their veterans designation on their driver's license, or getting connected to behavioral health services or employment services. What we try to do is serve as a bridge. To bridge that gap, to ensure that we're providing for that veteran a warm handoff. If they are experiencing struggles with Just the other day, for example, Friday afternoon, I received a call from a veteran who was having trouble getting his prescriptions refilled. He is seen at the DC VA Medical Center. His primary care physician had just retired, and he had not been assigned a new primary care physician yet. And he was explaining to me over the phone that he was really struggling with trying to get his prescriptions refilled when he was calling the VA pharmacy down in Washington, D.C. So what I was able to do was I put him on hold. I called the patient advocate's office down at the DC VA Medical Center, spoke with the patient advocate, explained to the advocate what was going on, switched back over to the veteran that I had on the line, let him know that I had just spoken with an advocate, gave him the individual's name. I let him know that as soon as we hang up, this advocate's going to be calling you, and then he's going to call me back to close the loop. And that's exactly what he did. I hung up with the veteran, the advocate with the VA Medical Center called the veteran and then called me back to let me know that he had resolved the situation for the veteran. So we try to kind of help bridge those gaps for a veteran that might be just returning home to the state. They come home and they say, I don't know where to start. I know I need to enroll in health care. I want to file a claim for disability. Maybe I'm underemployed and I want to get some career placement assistance. You know, we can serve as an advocate and have that conversation with them and get them connected versus just kind of giving them an 800 number to call. We can connect them, give them a name, and give them that warm handoff.
Yeah, well, that's impressive. You know, to be able to do that sort of hand-to-hand handoff, because you're right. Most of the time, it's sort of like, here's a phone number, and you know, good luck. But that's really impressive. So, with these other advocacy activities that you're doing, plus all of this outreach, is there any tips that you could give us as far as a small community is concerned to kind of do this? Because we don't have any names and addresses that we can send something to.
Mm-hmm. I would say first and foremost, just like what we're doing here, is to begin building collaborative partnerships to find out who it is in your community that is serving veterans, and come together and have a roundtable discussion on what's going on in the local community, because there's strength in numbers, I firmly believe, and it's getting a better handle on what's already going on and coming together to set some actionable deliverables for how to engage most effectively in the veteran community, because there might be a nonprofit in the Bowie area or the larger Prince George's County area that has some best practices that they can offer to you. So I would say it's building community partnerships and then elevating it to getting the your word out through those partnerships and ultimately out to the veteran community.
Well, it's kind of hard to believe, but our 30 minutes are up. We want to thank Dana Hendrickson for being our guest as the Director of Outreach and Advocacy Programs for the Maryland Department of Veterans Affairs. She does a lot of work. I don't know how she gets it in all that time. But now we ask you, for veterans and your family members, to stop by the DAV on Route 197 or the American Legion on Laurel Bowie Road and find out about the programs and benefits that are available to you and your family. We're there to help you. You've earned it. Why not find out about the benefits that can help you and your family? So once again, we want to thank you for watching Veterans Forum.